for tonight's dinner keynote. From Walgreens, please welcome Patrick Carroll.
Well, thank you. I've never given a talk after dinner, so I don't know how this is going to go. I think I had one too many drinks out there, so I'll warn you. My style is pretty informal. I'll tell a bunch of stories. I won't tell you which ones are true or not true. I'll let you to figure that out. But I just want to talk about kind of where we see healthcare going at Walgreens. And I know this is about customer experience here. And what I was thinking of today is I'm at the Ritz. What a perfect place to have a customer experience conference. I got in early enough to spend some time at the pool, and I'm sitting there in this eclectic area. I just gone for really an amazing run out into the mountains there, and they served me frozen blueberries. And then after that, they giving you water all the time, and then later that evening, my wife and I went back to the pool, and we ordered 2 drinks, and they came up to us and said, you know what, we realize it's the first time here, the drinks are on us. And I was thinking, that's where Walgreens could solve their front of the store retail problem. Just give people frozen blueberries and free drinks. And we wouldn't have to worry about Amazon anymore. So why am I here? I'm just here to talk about customer experience, but also about what we're doing in kind of the healthcare space. The other reason I'm here is I speak a lot around the country and live in Chicago in the deep, dark winter. It was really dark and cold there this winter. I went to speak at a conference in Tampa Bay, and it was like 85 degrees on this February day. And I got there early. I left early. I left my wife alone with my 2 labs. And I made the big mistake. I took a picture of myself at the pool in Tampa Bay and texted it to my wife. And she texted me back and says, don't you know me better than that? Why would you ever do that? So I said, I owe you a conference. When I got invited to this, I showed her, the Dove Mountain Resort, showed her the website. She goes, I'm on that one. So she's here tonight. So she's in on this. So thanks for having me. So anyways, we're a big company. I'm not going to go through that. I think the one thing I want to point out, my executives would hate that, me going over that. But anyways, the one thing I want to point out, I came from the health system world. I actually came from the primary care world for 25 years. I did the traditional 30 patients per day, panel of 3,500 patients, 8 to 5, Monday through Friday. Good luck on the weekend or evenings. You'd get my answering service. Hopefully they gave you the right directions. And on Monday morning, you waited for the onslaught of patients because everyone was sick over the weekend, and they'd wait to call their doctor's office on Monday morning. That model in terms of managing those big panels and increasingly complex patients and primary care providers being responsible for quality and cost, it's an unsustainable model, and it's the hardest job in the world. After 25 years of that, I kind of transitioned to the medical leadership role, becoming a chief medical officer for a large group in Boston, and then an integrated system in Hartford, and then at Walgreens for 4 years. And I can tell you the hardest work I ever did was as a primary care physician. And so when we talk about value-based care and moving the ball down the field in terms of reducing costs, and primary care doctors can get it done, we have to think of a different model. And that's something I'm going to talk to you about today and tonight, and also about how we keep patients engaged in what we're doing. So the one thing I didn't realize, though, coming from the primary care world or even in the health system world, is that pharmacies, whether it's us or CVS, have a tremendous impact on the customer and the customer experience. We touch 8 million patients per day, 6 million in and out of our stores, 2 million virtually on our app, which is downloaded 50 million times, as well as our website. Medication adherence is probably one of the biggest challenges in healthcare, and the pharmacists have a key role in that. So don't forget the pharmacy on that part of healthcare, which is critical. And so here's what I'd like to focus in on. I lifted this from an advisory board. I did give them credit. But really, what do health systems need to become consumer-focused? 5 years ago when I was at Hartford Healthcare, it was a great health system, $3 billion, integrated delivery network. We did not think about this, believe me. The feeling was, build the towers, they will come, right? You build the towers, they will come. Let's not worry so much about the consumer experience. But there's been a complete change in this world because health systems, and many of you actually work for them and got your jobs because they've discovered the consumer experience. That is very, very important. Some of that's forced by CMS and commercial payers. They want to know how you're tracking consumer experience. And here's what we see at Walgreens, and I think the advisory board hit on this also, is that this is what consumers are looking for. They're looking for really user-friendly experiences, not user-unfriendly. Consumers say that they want price estimates, and they want information on the quality and the patient, the provider ratings, right? They want to know what's the deal with that provider. And as a provider, the last days I was in practice, the Yelp reviews, oh my gosh, sometimes it would kill me. I said, why do they have those things? But that's what consumers want. They're going online all the time to get health information. The other thing they want, and we'll talk a lot about this, they want access to care. They're not going to pay, they're not going to be happy with 8 to 5. They want care when they need it. And they need it at access points that are convenient for them. Quite honestly, some of the academic medical centers in some of the most inaccessible parts of the cities, really difficult to access care. And then they want attention to service quality. They assume that quality is there, but it's really important that you don't slip up on quality. And then this is one that I think we really need to focus in on, not only access, but price transparency. This is critically important. 91% of consumers actually say they want price transparency, but they're not able to get it today. I've experienced that, several times in my own situation as a physician in my family. I have a millennial. Who is millennials in the audience? Raise your hand. Godspeed, right? Can you get them off your cell phone plan? Like a couple of my millennials make as much money as I do, and they're still on my cell phone plan. But I don't know how they do that. But anyways, the millennials, they want to know how much they're paying for, because many of them, as we do, have high deductible health plans. They're paying out of pocket, and they're trying to figure out where and what they're getting for their dollar they're paying. In my own family, as my wife is here, we had 2 experiences in the past 2 years. So you think as a physician I'd understand our healthcare system? Great primary care physician. When you turn 50, you get a colonoscopy, so she ordered a colonoscopy. And I said, are they in network? Oh yeah, my primary care physician office staff said, Aetna's network for Northwestern, right? I'll name the name here. So we go downtown, I drive downtown with my wife. Oh, it's beautiful, sweet. And as I'm sitting there and, they give you the bathrobe and, man, it's first class experience. I said, I hope they're in network, because this looks like a $4,000 procedure to me, as opposed to $800 procedure. Oh yeah, we checked. Got the bill, $3,800. Aetna's out of network. How was I to know that, right? Where do you find out about price transparency? It doesn't work, the system today. Does not work. My youngest, who's my 28-year-old going on 13, she works in Boston. She's got a great job, thank God. So she's running one day, slips. She's running along the Charles in the winter, twists her knee, and she takes a picture. She's been doing like telehealth, showing me strange rashes for the last 15 years, making me very uncomfortable as I'm at a meeting and I get a rash from my daughter. But anyways, so she slips, she takes a picture of her knee and texts it to me, says, Dad, what do I do? And of course I text her back, probably a sprain, Motrin, ice, you don't need to see a physician. And so my daughter, as your kids probably are, your millennials, they ask for advice so they can say, I'm going to do the exact opposite. So of course she goes to a primary care doctor who's an internist and knows nothing about orthopedics. He recommends an MRI. She texts me back, says my doctor wants an MRI. And I am the insurer of last resort because she's got a high deductible health plan. So I'm looking at $2,000 to $3,000 out of pocket. So I actually went online and researched. You could get that MRI at the shiny health system on the hill or on the river in Boston for $3,500, or go to the Catholic hospital system, who's really aggressive in pricing, for $700. So I said, here's where you get an MRI. Of course, she got it. It was negative, but I only had to pay $700 as opposed to $3,500. So, we need to have better price transparency. And then transactional relationships. We need to bring in customers if you're a health system, but also create that stickiness such that they're going to stay with you. 7 out of 10 consumers will switch their primary care doc for a suboptimal experience. So it's really important that you give a great experience, but also have the stickiness to keep them in your system. And I'm preaching to the choir on that, I'm sure. And so here we are, is this world we're in. They're shopping for experience. They're using all kinds of apps, and they're navigating their experience. They're bearing more risk as really the high deductible health plans now approaching 60% of customers, and the average deductible for an individual is $2,000, $6,000 for family. And they're no longer going to be patient. They're going to change if you don't provide that experience for them. And so here's where we are at Walgreens. I had a present last week with a buddy of mine who we run this kind of new strategy at Walgreens. And it was a conference called Health. Did anybody attend that? It's pretty amazing, right? And so my feeling as I went there, I signed up for it like a year before, then all of a sudden I saw it got bigger and bigger. There were like 4,000 attendees there. Mostly were not physicians, mostly were not health systems. They were folks who have actually come into the healthcare space because as physicians and health systems, we've not provided the solutions. So it was a lot of startups, really innovative ideas. We presented there around what we're doing and what I'm going to talk about around our healthcare neighborhood strategy. And as the executives of Walgreens realized that there was lots of investors there, they were freaking out and said, don't have this slide in here because it shows that the curve is going, the line is going down. And really this was our kind of epiphany moment at Walgreens, is that we saw, and we still see today, that the front of the store is very challenged in terms of our retail products. So, 75% of the space in our store, we sell things like cat food, batteries. I went into one store in Denver a couple of months ago, and there's 12 different types of playing cards. And I talked to our CEO, and I said, why are we selling 12 different types of playing cards? He said, I don't know. Do we do that? Well, we do. But we're also getting squeezed on the front end from the Amazon, but I would also contend that the Dollar General and the Family Dollar stores, which are, there's 15,000 Dollar Generals out there now. Why? Because they offer a low price, and they're growing. And so it's hurting us on the front end. So what we realize is, why do we devote so much space to the front end of the store? Why not shrink down that space and offer square footage for health entities? Because our core business is pharmacy. So why not bring in health adjacencies, health access points that tie into our pharmacy? So this is our aha moment, where we said, we're just not going to watch things change around us. We're going to actually be proactive. So what we've done is we've looked at all of the access points to care, and one that's not even on here is digital health. Telehealth is huge. The wave has not broken, as you know, yet, but it is going to. So you need to have telehealth assets and a way for your consumers, if you're a health system, to connect into your system. Retail clinics. So when I came to Walgreens, I was hired 4 years ago to build a number of retail clinics from 450 to 1,000, like our competitor. When we looked at the value of it, we saw retail clinics are valuable, but I coming from a health system, said, why not have health systems run them? And so what we've done is we've very intentionally gone to a different model where we actually have health systems run our retail clinics. And is there someone from SSM in the audience? Great. So you guys run 27? Yeah, I'm pretty sure it's 27. But it's been a great relationship. We partner around pharmacy programs. SSM runs our retail clinics. They hire the nurse practitioners, and it's on their EHR. So if someone needs a follow-up appointment, they need to see a specialist, it's absolutely seamlessly connected back to the system. So retail clinics, we see the huge value in that, particularly if health systems run them. Primary care, it's a big problem. A study came out last week, year 2030, we're going to have a shortage of 130,000 physicians. There's not enough primary care physicians to go around. So you have to start thinking about different access points of care and different delivery models for care. Urgent care, very valuable, particularly if you're trying to reduce costs and offload what's going on in your EDs. We're in the emergency room, high-cost visits for some low acuity conditions. So all of these access points, why can't we use our 10,000 stores to bring in some of these healthcare access points? and be very consumer-facing, consumer-focused. So here's when we talk about partnering with health systems. What do we bring? We bring great digital health assets. We bring a national brand and super locations. 10,000 locations now that we brought in a fair amount of the Rite Aid stores, a little less than half around the country. Great access points of care in some of the best locations in your neighborhoods, spread out geographically. I think someone told me we're within 5 miles of 75% of consumers in this country. And what health systems bring in is the clinical expertise. So that you guys run the clinical care model. That's your core competency. And healthcare is local. So to have a brand like SSM in St. Louis, that's huge. Because in the retail clinics that we ran, and we still run 160, sometimes when folks come in, they weren't sure whether they're seeing a pharmacist tech, a med tech. You know, Walgreens wasn't necessarily associated with delivery of healthcare. So this is why we partnered around these kind of consumer access points. And what we've done really robustly is use our digital health assets to create an Expedia-like experience. And actually, we just launched today this new application. Is called Find Care Now. So that app that I told you is downloaded 50 million times. That website that is accessed 2 million by 2 million customers per day. Why not have that as the top end of the funnel to tie back to health systems, health system partners, to connect them in a frictionless way into their health assets? So that's what we've done. And on our website, in the next 3 months, today we actually offer, you put in the zip code, it will tie into those access points, whether that be urgent care, retail health, ED, or primary care. But within the next 3 months, we're going to have, if you put in your health insurance plan, it'll give you price transparency. And then if you put in your chief complaint, sore throat, it'll direct you to that access point to healthcare. So really that Expedia-like experience through the Walgreens website. And so this is what it looks like. We now have a feature called Find Care Now, and then you can actually get a digital health visit with some national players like MD Live or Dermatology on Call, behavioral health, or tie into the healthcare system's digital health or virtual health visits, or connect with them around their retail clinics or urgent care. And we've done this already with 2 major partners. One is Providence, great health system, Pacific Northwest, actually in 5 states, and really innovative group. Folks heard a guy named Aaron Martin, Executive Vice President for Innovation at Providence. He came from Amazon. He understands the consumer experience. He has a big team, over 200 folks on his team, who really focus on the consumer experience, particularly in the digital space. And so we've learned a lot from them, and we've partnered very closely, such as in Providence. You can go on our website, and you can get for example, in Seattle, you can visit the Swedish Express Care, and what it does, it ties you in to every one of the health assets and full price transparency. So Express Care clinics, these are the 25 clinics that are retail health sites run in Walgreens by Providence healthcare providers. It ties you into their virtual healthcare assets. You can get a home visit with a nurse practitioner, or you can get scheduled into the urgent care. Again, frictionless, top end of the funnel through Walgreens, connecting with a really valuable health system partner that has full price transparency. And this is a really interesting partnership we have with New York Presbyterian, the same type of connectivity to their virtual health assets, but we've actually set up with them 4 sites on kiosks. And the kiosks are actually in Walgreens stores. They're called Duane Reade in Manhattan. And someone can go in and have a virtual visit on their kiosk. And the kiosk is powered by American Well, and it has peripherals, blood pressure, pulse oximeter, temperature. And you actually connected with an ED physician from one of their Columbia or New York, Columbia or Cornell emergency room groups. Now, why is this important? It's hard to access care in Manhattan, right? And it's not only hard to access care in Manhattan, it's expensive. So very price transparent, so $99 visit. People say, well, that's expensive for telehealth, but it's New York, right? But anyways, Great case. We've only done this the last 3 to 4 months. 6 weeks ago, 35-year-old shows up into a Duane Reade going in to get cold medication. Why? He thought he had a cold. In fact, he was feeling so sick, he said, you know what, I think I need more than cold medicine. He saw that we had a Duane Reade, New York Presbyterian telehealth asset. He walked into that room, connected into the ED physician. Because we were able to do a blood pressure monitor, 220 over 120 blood pressure. If you're not a physician, that's very high. And in fact, he had pulmonary edema, congestive heart failure, so hypertensive emergency. They directed him right to a New York Presbyterian hospital, found out he not only had hypertensive emergency, he had the congestive heart failure associated with it, and he had uncontrolled diabetes. So there's someone, 35 years old, no primary care physician, and my millennials don't want primary care physician, they just want immediate access to care. He was able to get connected and to get health care through a virtual visit. The peripherals do help. In other words, I don't think that would have been done as well off of a cell phone, and a really high-value provider group, emergency room physicians, receiving that visit. So we think there's a lot of growth and potential here. New York Presbyterian has come out publicly and said they want 20% of their provider visits to be virtual in the next 5 years. So they are very invested in this model. So retail clinics, let's talk briefly. This is a great access point. The challenge with retail clinics is they usually only see 25 to 30 diagnoses. We see when health systems start running them, they're able to expand the scope of care, which we think is valuable because it's their providers on their EHR. You know, the value to a health system on the retail clinics is not just providing care for some of the customers in the area. Quite honestly, it's patient acquisition. And Providence has reported that this is a great patient acquisition strategy. Their patient acquisition cost is significantly less when they have both retail health but also virtual visits. Rather than having to go out there and buy or hire or create large primary care groups, why not have a retail health access point to care as well as a virtual health access point to care? So in typical retail health, this is kind of what we see. We do a lot of immunizations, a lot of on-demand care, and the opportunity in retail health, quite honestly, is the folks who go in and out of our store, the average diabetic is in our stores 30 to 60 times per year. So why not have an access point for health care at our stores? Because they're coming in and out anyways. And we do currently run about 160 clinics on our own, but we have these really great relationships around health systems where they run our clinics. All over the country. SSM is one. We're in Atlanta, we're in Providence, Vanderbilt. And they really like this model because it gets them into the community, out of the towers, right? That new way of thinking of how to engage consumers. Price transparency, prices are listed, and an access point to care on the customer's schedule and not our schedule. And so we're all over the country. Most of them now are being run by health systems. Urgent care. So this is something that we decided, you know what, we want to look at urgent care. And since we have all this extra square footage, why not take 2,500 square feet and actually run urgent cares? We've done this now in 15 sites. We did it in a pilot partnership with MedExpress, which is run by Optum. And so essentially, if you look at this photo, you take a third of our store and you put an urgent care in with a separate waiting room, 6 exam rooms, a imaging suite, and they can take care of about 95% of the customers that go through their door, so a really wide scope of care. It's been a great pilot for us because what we realize is about 40% of the customers who actually go into them because they drive by and we have great locations and they see, well, there's a urgent care with a national brand, and we're going to do this with health systems, so it could be a health system brand. I can get an urgent care visit, and I get my script filled at Walgreens, right? Because internal to this MedExpress is actually a door right into a Walgreens pharmacy. And you have a pharmacist there that can actually coach and counsel them on the medications that are prescribed. So we see ourselves doing urgent care with both health system partners and perhaps with the national player all around the country. And again, why are ER costs so expensive? Hard to say, but what we know is that The average visit in an ED is about $2,000. There's an interesting study came out by the Healthcare Cost Institute looking at 40 million employees, and what they found is the average cost was around $2,000, and the price actually went up 31% in 2016, with the utilization that only went up 2%. So the payers are now catching on to this and saying, why are folks utilizing ED for sinusitis and sore throats? We're just not going to pay for it. And so we have to create more access points to care, particularly at a retail health, virtual, or in an urgent care. And we're also doing lab services. So we have a partnership with LabCorp around the country. We've, I think, set up 12 of these, but we plan to expand that. Why does that make sense? Well, have you folks seen where some of the lab drawing stations are? They're not in great locations. It's very inconvenient. And what we learned from LabCorp is that 70% of the journeys to get a lab test starts from home. It doesn't start at a doctor's office. So why not have a convenient location where you get your lab tests, you can get your script filled at a Walgreens? And so what they've publicly reported for them, 18% of the folks who come into their standard kind of freestanding lab services are new to LabCorp. At Walgreens, when they go to use the Walgreens LabCorp site, it's 28%. So again, great customer experience. NPS scores, I think, are over 93%. Customers love it, and it's very convenient for them. So this is something that we'll be expanding. And then we're doing optical services. I'm not going to go into too much detail, but why not be able to do diabetic eye exams, which are really important to get done at a Walgreens. And then we're also doing hearing services. And so the last thing I want to touch on is that whole aspect about customer stickiness and affinity. We actually have a program called Balance Rewards. Anybody in the audience on a Balance Rewards or know about it? So we have 88 million folks who are signed up for this. 88 million. And the kind of stickiness in that program is 70% of them stay on it and stay loyal to it after a year, much higher than for your typical monitoring device looking at steps or blood pressure or whatever you have. So people like it, and what we've done is we set up this program such that you get rewarded through points, which are converted to dollars at Walgreens for healthy behaviors. So we'll track things like your steps, your weight. It will guide you towards websites to get health information about your diabetes, some virtual weight loss programs, some smoking cessation programs. We have over 2 million apps that are actually tied into the Balance Rewards. And so we've found this program to be very valuable because it focuses on 3 areas: get fit, eat right, and manage your health. And that's the core. And what you get is you get points for doing each one of those. And the studies show that actually it works in terms of improving adherence for diabetic patients, reducing, average of 3.3 pound weight loss for those who are active on Balance Rewards, and actually improved adherence for hypertensive patients. So we got these results over the last 2 years, and so this year was a no-brainer for us. We have 300,000 employees. We are putting all of our wellness programs based on the Balance Rewards platform. So once we get, and the initial results are very strong, we get positive results from this customer affinity program for our own employees, we'll be going to partners and saying, you can use this as the base for much of what you do for your wellness programs for your own employees, and be able to connect all of those wearables onto one platform. A partner can actually decide how many points they want to get for give to each category, and really incent behavior that you want to drive. Maybe that's getting your mammogram, colonoscopy you get so many points for, or exercise or weight loss. So we think it's going to be a valuable tool when it comes to really not only customer affinity, but also promoting health. And it helps with adherence. I won't go into details about this. So anyways, that's kind of where we're at Walgreens. We're looking at consumer experience. We're looking at access points and price transparency. And this was probably me in high school. I was always looking out the window when I should have been listening to the teacher. But as the teacher says, don't worry about it, things are not going to change. Well, they are changing out there. And as health systems, we have to do what you guys do every day, and what you're tasked to do is really focus on the consumer and figure out how to get them engaged in their own health. And this is our vision, really, is to become not only a pharmacy, but also provide healthcare services in collaboration with health system partners. And so I'm going to tie this all together with this created by my partner about what a Walgreens is going to look like at some sites today and in the future. You'll go in to a Walgreens, you could have a retail clinic through like a Providence. This is on one location, so a good access point to care. And then coming out, there will be all these other health adjacencies, as we call them. Urgent care, again, this will be attached to Walgreens, but that internal door into a pharmacy, so you can actually connect, get your script filled at the pharmacy. And this will be branded either with a national player or with a health system partner. And today, currently, as we said, we do it with 15 with MedExpress urgent care. And this is actually what it looks like. And then finally, if you come out, in some of our stores, we have the hearing and vision and lab services all co-located in one store. So it's really coming into a Walgreens and looking at an optical shop, and then going down the hall, the hearing and vision services. So that's kind of where we're at, thinking a little differently. We see the demand. It's been very strong response coming out of the gate. And we feel the opportunity is focus on the consumer, but also partner with some of the leading health systems in the markets that we're in. So that's it for me. Any questions? I did finish under 33 minutes. So I think the next time I speak, I'm going to drink more wine beforehand because I did that in rapid time. So questions? If I can see anybody?
So if a patient comes in urgent care and you newly diagnosed diabetic, what's the transition of care to a more long-term relationship with a provider? They don't keep coming back to Walgreens, right. I assume.
And we don't want them, and neither does the urgent care provider. So if it's run by MedExpress, they have a list of local providers that they can connect with. If it's run by the health system, and many of the health systems want to get into this space with us, it'll be on their EHR. If the the customer does not have a provider, they can actually set up that appointment right there with either an endocrinologist or a primary care provider. That's where we see the real power, is if we collaborate with the health system for them to be able to connect directly into their assets from a community location. Yes?
So I heard from a lot of the emergency departments and you had a statistic up there, maybe less than a third of the patients actually get admitted when they go through the ED.
It's actually, it's a low number.
Yeah, very low number.
It's actually even lower than that. It's less than 10%.
Less than 10%.
Yeah.
So they could be going to the existing urgent care clinics in the neighborhood. How is Walgreens now going to attract that population that isn't maybe educated on where to go when it's something simple or simpler, where they should be going to the urgent care clinic today and they're not? They're going to the ED.
Yeah.
How are you going to get them to Walgreens?
So part of that Find Care Now is education on our website. These are the conditions that are appropriate for an urgent care. This is what's appropriate for retail health. So I think some of that is consumer education through the website. Folks are going to still show up where they don't belong, and of course we'll care for them. I'm a big believer in urgent care. I know that it's an industry that's growing. It's pretty fragmented, but I think there's going to be significant consolidation. There's over 8,000 or 9,000 today. I think they're great access points to care. 3 of the urgent cares we purposely put in rural locations. It's been our best pilot, because in those communities, they are the access point to care. There's not an ED this close. There's not a physician group this close. So I think it is, you're right, it's customer education. Which access point to care makes the most sense? Which is the most appropriate? I think there is increasing pressure from the payers to direct them away from EDs, because they're looking at the costs, right? And they're getting pressure from the employers to say, look, We can't, this is unsustainable. These $2,000 sinusitis visits, we just can't support those. Yes?
Why now versus 3 years ago or 3 years from now?
Why are we doing this now?
Yeah, why?
So you saw the graph, the one that, you know, that shows our business model is changing. It's being challenged on the front of the store. So all of a sudden, quite honestly, 2 years ago when I was at Walgreens, we said, let's do more retail clinics with health systems. We said, wait a minute, we can't shrink down the retail space. Now they're saying, shrink down the retail space. Because our future is not going to be necessarily in more retail space, it's going to be in less. So that's the burning platform for us. And it always comes back to Walgreens, pharmacy is the core. So we're thinking, you know, as that market is even challenged in terms of margins, we need to drive more volume through, appropriate volume. That's a great question. So I didn't point it out. On the telehealth through MD Live, we have a behavioral health connection point. So someone can go on, they can get a behavioral health visit through MD Live. It's sponsored by the Mental Health Institute, and you get a PHQ-9 done, and they'll actually connect you with a psychiatrist if they think is appropriate, or a counselor. When we launched that 2 years ago, we were overwhelmed with the volume of the response. It's huge. I think telehealth, as many of you know, and behavioral health are good partners. I think it's a great way to use an access point to connect with limited resources. And there's lots of really innovative programs around telehealth in terms of screening and how to get those visits virtually.
So the strengths are fairly obvious. In terms of the threats, where do you see the biggest threat, and what are your mitigation strategies?
In terms of this model? Yes, sir. I think the biggest threat in healthcare is really you know, we talked about the price transparency and access points, but it's also the siloing of care, what we think is very important, and why we've gone after these health systems relationships, how we're going to connect folks who are accessing care to a system or a way to them get higher levels of care. And so I think that is a real threat, is as we see different players in both, you know, virtual health and you know, retail health, how we connect them and make it pretty frictionless and seamless, such that if you need a higher level of care, you know where to go, and you actually get an easy referral into that system. So the threat, I think, is the siloing of care.